We have identified 126 new COVID cases today. This brings the total number of cases to 1,996, though this is preliminary at this time. No new deaths have been reported since yesterday. As expected, we have seen an increase in testing numbers as we have expanded testing to all Albertans. Those who are experiencing symptoms of COVID-19 who live anywhere in the province can be tested by going to the Alberta Health Services online assessment tool. We have completed 2,853 tests over the last 24 hours. Tomorrow, we'll have updated information on cases, as well as the latest numbers for recovered cases, hospitalizations, and continuing care reporting. Today, I would like to report a new outbreak at the Curl Lake Oil Sands project north of Fort McMurray. Currently, 3 people connected with this work camp have tested positive for COVID-19. 6 more individuals connected with the work camp were tested yesterday and are currently isolating. Their results are expected shortly. Alberta Health Services continues to work closely with the company to implement outbreak procedures at the site and to minimize any risk of transmission. These procedures include appropriate cleaning and infection prevention, as well as continued emphasis on following my guidelines for managers and operators of industrial work camps. This includes a focus on physical distancing, isolating any employee who has COVID-19 symptoms, and limiting gatherings as required. I thank the employees, managers, camp operators, and employers for their continued diligence to keep these camps functional and contributing to Alberta's economy positively during a very challenging time. We will continue to update you on the situation as it evolves. I'd also like to provide an update related to meatpacking plants in southern Alberta. Over the past few weeks, there have been a few different meatpacking plants that have had cases of COVID-19 reported. You will recall that a few weeks ago we talked about a Harmony plant, and that has been resolved. Local public health has worked with that location, as well as a location in High River, as they do at any work site where exposure may have occurred, to ensure that any close contacts are isolated for 14 days and to prevent transmission in the workplace. As I have previously said, COVID-19 is not a foodborne illness. There is no risk to the public from food produced at these facilities. The facility in High River is experiencing a need for increased testing, and to accommodate this, Alberta Health Services will be opening a dedicated assessment centre there in the coming week. This will be accessible through the Alberta Health Services online assessment, or for those without internet access by calling 811. Even before that dedicated assessment centre is open, anyone in that area can access testing by going through that online assessment tool or by calling 811 if you do not have internet access, and you will be directed to the testing site closest to you. For all businesses and workplaces continuing to operate during this pandemic as essential services, I would like to emphasize the importance of following public health guidance and recommendations to limit the risk to staff and the public. This includes performing hazard assessments for all duties and undertaking steps to control the risk of transmission of COVID-19. Finding alternate ways to hold essential meetings of large groups, such as teleconferencing, and implementing business continuity plans to prepare critical operations for any potential interruption. I encourage business owners to visit the Alberta COVID website for additional workplace guidance on how they can protect themselves, their staff, and their patrons. We have seen, as we've expanded our eligibility for testing as we expected, we have seen an increase in cases because we are testing more people. But as you note, our hospitalizations have remained relatively steady. And this week I've been working with our epidemiology team to track the hospitalization trends in a bit more detail. As you note, you can see that the total number of cases in hospital that we report every day has remained relatively constant. But that number is a function both of new admissions to hospital as well as how long people stay in hospital. So for example, if someone comes into hospital and only stays a couple of days, they're only counted on those 2 days. But if somebody comes in and they stay for 3 weeks, they count every day in that total count. So what we need to do is look at not just those total hospitalized on a day-to-day basis, but what the new hospitalizations are and what that trend tells us about transmission in the 2 to 3 weeks prior to that point. And that's exactly the work that I'm doing with my epidemiology team right now. And we hope to have something that's available for the public to see on those trends by the end of the week. But those trends in this early work do seem to be roughly stable, similar to these other numbers. And so again, I would anticipate that by late this week, we will have more to say about hospitalization trends. But what I would also say is stable is good. It's better than rising. But what we'd like to see are those trends decreasing. And so far, we're not quite seeing that yet. But again, we're doing some work to break that apart, and I hope to have more to say at the end of the week.